This talk is about how we can actually get people to change their behavior. Not everyone will do what the authorities and experts tell them to, even if it is for their own good. We know that exercise and eating right keeps us fit and healthy. Yet many of us are couch potatoes, and over 2 billion worldwide are overweight or obese. We know that texting and driving could lead to horrific crashes, yet that is the cause of 1 in 4 car accidents in the United States. And in COVID times, many people are congregating with friends, rushing to the beach in droves, participating in rallies, and so on. We tend to believe that awareness and education alone can change behavior, but clearly that is a myth. Let me introduce you to the science of social marketing, which can help bring about the change in behavior. Social marketing, not to be confused with social media marketing, this is not about Facebook or Twitter, uses the principles of commercial marketing and behavior change theory to make people change their behavior for their own good and for the good of the community at large without any personal gain to the marketer. What could persuade a person to change their behavior? The health belief model, which was proposed in the 1950s, has several constructs. The two most important constructs are perhaps perceived benefits and perceived barriers. If a person perceives the benefits of a behavioral action as tangible and personal rather than intangible and societal, they are more likely to adopt the recommended action. Similarly, if the barriers to the action are perceived to be low, that again will make them more likely to act. Let me now take you through a case study to show how social marketing can use these insights to change people's behavior. In the 1970s, Bangladesh embarked on a family planning campaign. Bangladesh is a poor country with one of the highest population densities in the world and limited resources. Effecting a reduction in fertility rates was hence of paramount importance. The campaign initially relied on male contraception and promised reduced pressure on resources and a better quality of life for all if population growth slowed down. These benefits, however, failed to impress the audience. The social marketing team, decided to find out why. It became evident that men perceived things differently from women. Men saw the benefits to be largely intangible and societal, not personal. The success of the campaign was dependent on widespread adoption of family planning measures, something over which an individual had little control. Besides, many children died young, and having more children was seen as security in their old age by men. The barriers to family planning thus loomed large. Women, on the other hand, were more favorably inclined to the idea of family planning, perhaps because of the adverse impact that repeated childbearing had on their health. But it was the men who took the decisions at home. The team then decided to change their messaging to tell men that their wives could look after them better if they had fewer children. The benefits were thus presented as tangible and personal rather than as societal. The emphasis was shifted from male to female contraceptive devices. Bangladesh is a conservative country where women are embarrassed to step out of the home to procure contraceptives. So these were delivered through rural women medical practitioners who made house calls. The campaign now saw dramatic success. The number of couples in the target audience practicing family planning rose from 44% to 45% in just 10 years. The team thus managed to reposition the desired behavior from what appeared to be intangible and societal, as represented by the lower left quadrant here, to tangible and personal, the upper right quadrant. At the same time, they managed to lower the perceived barriers. Now I know that I am guilty of oversimplification. Obviously, there was a lot more to the campaign, and there is a lot more to social marketing. I hope, however, that I have given you a glimpse of what social marketing can achieve. What can we learn from all this? If we want to influence COVID-19 behaviors, we have to do so in context, not in the abstract.
Second, that the health behavior model tells us that individual health behaviors are dependent on perceptions that people have of the benefits of a behavioral action and the barriers to its adoption. Third, that social marketing is a powerful tool to get people to adopt the desired behaviors for their own good and the good of others. Lastly, the Bangladesh case study is an example of how this can be achieved. It also reminds us that behavior is always culturally anchored.
So, what should we do? To start with, we need good surveys before we can come up with a social marketing plan, and these must be local surveys.
I carried out such a survey, admittedly an unscientific and informal one, in Chennai, India. And here's what I found. The benefits of social distancing were perceived to be low. People found it especially difficult to imagine that they can be infected by someone who is asymptomatic. On the other hand, the barriers to social distancing were seen as high. You can't just shoo away someone who comes near you, certainly not in crowded places. Hand washing, however, was seen as highly beneficial. People imagined the virus being washed away into the sink. Now, health professionals tell us that washing your hands with soap and water is just as effective as using an alcohol-based hand rub. But there's a huge difference between the two when it comes to compliance. People found it difficult to drop what they were doing to go and wash their hands, even when a wash station was available nearby. And often it wasn't. Drying one's hands was also a problem. These were significant barriers to compliance. A hand rub, however, can be kept within easy reach for use without much interruption to whatever one is doing. Besides, the hand rub evaporates in seconds. The masks were seen as providing some protection, but also as a definite inconvenience, especially in a hot and humid climate. The straps could hurt, and if you wear glasses, they could fog, and there were other problems too.
My survey, nevertheless, opens up several possibilities. It became obvious that compliance with social distancing recommendations will be especially difficult to bring about. The benefits were perceived to be low and the barriers high, as you already saw, but there are possible solutions.
Hygiene instructors are known to effectively use graphic visuals showing germs jumping from one individual onto another. Similar visuals could enhance the perceived benefits of social distancing. We have seen markings in some public places to keep people apart, but we need devices like these pretty much everywhere to reduce the barriers to social distancing. When it comes to the all-important recommendation of hand washing, governments could subsidize alcohol-based hand rubs or even give them away free. That is very likely to increase compliance. Of course, the safety of hand rubs when used widely must be taken into consideration. Innovation in masks to make them wearable, bearable, and yet inexpensive is desperately required. Masks must be lightweight, soft, breathable, must remain dry, fit well, and mustn't hurt you. We already have several products on the market making these claims, but these are expensive and we don't quite know how good they are. Billions of dollars have been poured into treatments and vaccines. The humble face mask too needs similar attention and funding by governments. Social marketing could indeed mean the difference between life and death during the COVID-19 pandemic. I fervently hope that governments enlist the help of those who have experience in the discipline to augment the efforts of policymakers, doctors, health workers, epidemiologists, entrepreneurs, and others to restart our economies and to keep us safe.